So in this video, we are going to talk about when someone has a limitation in elbow flexion or bending the elbow and hand up towards the shoulder. What do I do? How do I assess that? And then how do I figure out what is causing that limitation? So as I take her elbow up, I feel like there is something that feels very bony to me here. The other option is there could be a soft tissue pull, a muscular pull on the back of her arm and her tricep, or there could be also a soft tissue restriction on the front where it just doesn't want to fold. But as I bend her elbow up, just go ahead and relax there, Jen. The first thing that I feel is kind of bony, all right? So I'm checking it with her hand faced up. I could also check it with her hand face down. And she actually gets a little bit more range with her hand face down than with it up. So I am more interested in mobilizing, figuring out what's limited with the hand up. All right, so there are two bones that may be limiting this. There is the ulna, which is the bone that goes down to your pinky finger, and there's the radius, which is the bone that goes down to the thumb. And I just kind of want to block the very beginning of that bone where it kind of attaches to the humerus, which is the bone of the upper arm. So I am blocking the ulna right now, taking her hand up, and I feel a hard infill right there to where that bone doesn't want to move any further. It just kind of gets kind of jammy. If I go on the radius, right at the beginning of the radius and come up, it overall is more springy there. There is a hard infill, but I felt it earlier in the range on the ulnar side. And she also has a little bit of soft tissue restriction here that I may, depending on how tender it is, if it's tender for her, which whenever I was assessing her before this video, she was like, ouch, so I would treat that first so that the joint or the bone mobilization will be more comfortable. But just to give you an example, I would come here, and so I'm localizing what kind of winds that tightness up the most. Is that okay there, Jen? Okay, and so now I would say hold here, don't let me move you. Good, and I'm just kind of blocking the beginning of that ulna, the beginning of the bone that goes down to her pinky, and let it go. And so then I would then see if I can take up the slack anymore, relax there, continuing to block, continuing to relocalize into that hard infill, both through my assisting hand I'm localizing, but also through my treatment hand as I'm trying to figure out what combination of angles makes that the tightest. And hold there, Jen. Don't let me bend your elbow. Good. Hold, 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 and let it go. And then let's just say, I don't have time, I'm not gonna actually treat it all out right now, but let's say that I've improved her range, and then I want to re-educate this. So now this is just an added layer into this video, is I am going to take her hand here and don't let me lift you out of this position. So I'm going to try to take your pinky up towards the ceiling, keep it right where it is, and don't let me lift you out of that. Perfect. And I'm kind of tractioning up towards the ceiling. Don't let me lift, because I'm trying to get her into her core a little bit here. So we could do a prolonged hold there. And then once I feel like I get a good connection into her trunk, then I could say, okay, slowly let me pull you out of this position. Good. And then pull up. Bend your elbow, take your pinky down towards the table and down towards you. So you're going to be rotating down that way. Good. And hold there. And slowly let me win. So I'm taking your pinky out of that. Good. And now you win. Bend your elbow, take your pinky down towards the table, so you're rotating down that way. Good. Hold. Don't let me move you. Nice. And let it go. And that last little bit is we're just trying to turn the muscles on in that new range of motion, so our brain is like, oh, I can actually use that, and I'll be more likely to use it in the future to maintain that improvement in range of motion.